Hey Professor, how are you? My name is Jonathan. I giving a presentation on my paper, which was drug abuse among people with diabetes. Just a little bit of a background on like why I even chose this topic. I'm a nursing student here in Monroe College, and I'm in the progressive program. So basically, what that is like each year you do a different level. So the first year is a licensed practical nurse, which is an LPN. Second year is registered nurse, which is the RN. And the last year, which I'm in right now, is the BSN, which is the Bachelor's of Nursing. So the only difference between like an LPN and an RN is that LPNs take care of stable patients, while RNs take care of both stable and both stable and unstable patients. Like an example of what an unstable patient is like someone who's like bleeding internally, or someone who is in critical care, or has intracranial pressure, which is like a lot of pressure in your brain and stuff. It's really anything that like where the patient's health can just change like in a minute, and registered nurses are the ones that take care of those type of things because, they're more educated on knowing what to check out the signs and symptoms. Whereas for licensed practical nurses, LPNs, they take care of stable patients. So a stable patient would be somebody with like a chronic disease, and what you're doing is you're helping them maintain their health, and they could be on this chronic disease forever. That doesn't really make them unstable. That just makes them stable, but just And one of the biggest chronic diseases that definitely LPNs and both RNs for sure, but LPNs for sure take care of are diabetic patients, especially when they work in nursing homes. And I worked at a nursing rehab center for about a year. There I took care of a lot of people with a lot of chronic diseases, especially like diabetes. And with diabetes, there's so much to do with it. So it's a lot of care. So with my paper, it talks about the relationship between drug abuse and diabetes. So at the nursing home that I worked at, a lot of the patients there before they got there were on drugs. And a lot of patients were different ages too. They're not like, nursing homes don't necessarily just have like old people. They also have people in their 20s, 40s, 50s, 60s, all around. Like I took care of a couple patients who were like 21, they had autism, and one of them was just in there for rehab, kind of a long-term care facility rehab, but they didn't have they were homeless. And at the facility I worked at was a facility that was mainly had like homeless or people on the lower economic status. Mostly everybody had Medicaid, so it was that type of crowd, and a lot of them had like drug abuse and sexual abuse past. So with this paper, I learned a lot about the relationship between drug abuse and diabetes. I had a patient once who was diabetic. He was only in his 40s. He already had like his right leg amputated and then his left foot cut in half. And a lot of that is because there wasn't a lot of blood flow going to his body. So basically with diabetes, you want to control it because if the more higher the blood sugar is, the more your blood kind of turns syrupy in a sense, it gets thicker. So the blood has to go throughout the whole body, to help oxygenate the cells, which is another word they use as perfusion. So to perfuse the cells and give them oxygen, because cells need oxygen to perform and, everything. So with this patient, he clearly had been doing drugs for a very long time. And that's how he lost his foot. His foot developed that's why he lost his leg. It developed gangrene, and with gangrene, you have to cut that off right away, or else it travels. And that's what it did. He said it started on his foot, then it went to his leg, and then it almost went to his kneecap. But luckily, he had the surgery, and they cut the leg off and everything like that. So, unfortunately, he doesn't have a leg, but So I found this paper to be really interesting, and doing this paper because, I learned a lot about that, with people who have diabetes, sometimes, they go through certain things like diabetic distress. It's funny because like I don't really have any family members that have diabetes, or at least ones that I know of, like my mom, my grandmother, they didn't have diabetes. But since I worked at the nursing home, one of the top patients I had again was diabetic patients. So I can understand with diabetic distress, it's a lot. When as an LPN, when I was working, it was, you have to prick their finger and take their blood sugar before they eat. And literally people eat 3 times a day. So could you imagine getting your finger pricked 3 times? But then on top of that, you also do one more time at nighttime, because usually at night, some diabetic people will have a long-acting insulin. Insulin is usually something that your body like produces from the pancreas. But, the issue with people with diabetes is that, especially like with diabetes 1 and 2, like especially with diabetes 1, that the pancreas is not working at all. Whereas with diabetes type 2, the pancreas could be working, or it used to work, then it just doesn't work as well, or, so some people are given like medication like the metformin, which is usually the first frontline medication you give to a diabetic patient, because what that does, it helps the pancreas kind of like put out insulin. But patients who have diabetes type 1, you can't give them metformin, you have to give them, insulin, and that's usually only through a shot. With diabetic distress, it's understandable, because why would you have to prick your finger to check your blood sugar? You have to give yourself shots before you eat. And usually you have to do it like 15 to 30 minutes before you eat. And that's a lot. And then you have to give yourself a shot at night as well. So I can understand, because that it could put a lot of emotional and psychological stress on people, I found that this paper was really interesting, or this topic was really interesting to me, because I feel like we really need to have a better understanding of how to help people who have diabetes, I think that if you have friends or anyone that that has diabetes, and maybe they're having trouble or struggling a little bit with them, you want to have support for them. Or if you're a healthcare professional, definitely you have to know what the signs and symptoms of diabetes distress, because that to me is kind of like, based off of like what I've written, I feel like that's kind of like a gateway to drug abuse in a sense, and it's interesting too. One of the things that I learned when I was doing research for this paper is that like even adolescents who have diabetes, and usually they have diabetes type 1, I can understand too, if you want to be a kid and you want to live your life, but then you have to give yourself shots and everything, like it's a lot, and then also with peer pressure with kids and other kids, and I'm doing all these drugs and stuff, it's a serious thing. So overall, I feel like one of the best ways to kind of like prevent diabetes distress, and also to prevent complications from drug abuse with people with diabetes, is like definitely emotional support, and making sure that people are psychologically okay, and maybe give them therapy or something. People who are doing drugs and have diabetes, we got to really like work on that before it becomes worse, because it can really be bad, and you got to make sure, even if somebody's doing drugs, they've got to take care of their diabetes, because if they're not, and then also one thing that really does make it hard to take care of your diabetes, and when you're a drug addict, is when you're trying to have a healthy diet. And healthy diet is kind of one of the big things, for diabetics, because there are a lot of foods there that have a lot of sugar and stuff like that, or like carbohydrates that do turn into sugar. It's hard. So one of the treatments for people who have drugs usually is like giving them methadone, which is something that is used to help them kind of help like lower the cravings of opioids. And then on top of that, like, the doctor will give them a dose and then usually like wean them down. slowly though, because you don't want to have withdrawal from like opium withdrawal, which can make everything worse. So, but anyway, in conclusion, I learned a lot on this topic, and yeah. And that's it. And I just also want to say thank you for a wonderful semester. I had an amazing time. Like, this was such a great class. I learned a lot about a lot of things, and it challenged me with my writing and everything like that. So really thank you. I take my RN NCLEX next month, which I'm really excited. And yeah, and we'll see, and everything will be great. And I don't know, but thank you so much. Have a great rest of the semester, and have a great rest of the year and everything, and good luck with everything. Okay, bye. Happy Easter if you're Christian. All right, bye.